let you know that I've been keeping an eye on the baked apples, and not all of you had one, so be sure to take one, because what you don't eat, we will. And it's not going to be pretty tomorrow. Just a few moments, we're going to be awarding the $22,000 in funding to 6 very special not-for-profit community organizations here at Mark Twain Medical Center. And all of these community organizations, one of the main criteria for acceptance of their proposals is that it shares the mission with Mark Twain Medical Center. And our mission, just so that all of you know how you relate to us, is that it's to improve the health of our greater community by providing quality healthcare services exceeding the expectations of those that we serve. So you can all link now to what your projects are. The program today is that we'll bring each and every one of you up here. No, not each and every one of you. But we do want to have a speaker come up from each of the organizations and remind us what your project is and how you're going to spend the funding that we're providing to you today. So those of you that are going to be speaking, you have about 5 minutes to think of what you're going to say, and try not to speak more than 1 minute or so. Besides having the opportunity to listen to each of us, or to listen to each of the recipients about their projects, this luncheon also provides us a chance to talk about our community benefit programs and celebrate our successes. So I do want to take just a couple minutes. In 2012, over 52,000 persons benefited from our community programs, our community benefit programs. Our highlights for the year included a total community benefit expenditure of over $32 million for this community. $32 million for our small hospital here in Calvert County. Charitable quantifiable benefits, included over $3 million in benefit to our more vulnerable populations. $40,000 for our broader community. We provided traditional charity care, unpaid costs of Medi-Cal and Medicare, community service donations, community health services and education, and community building activities. Our community benefit events included our health fairs held at the hospital in September, the one that's held in Ironstone in March, and our Valley Springs Health Fair, which is held in June last year, and will again be held in those months this coming year. At our county fair, we provided 24-hour coverage by nursing for the first aid booth, and we supported the fair and additionally with both volunteer hours and dollars. Our long-term improvement projects for chronic disease management are designed to keep people away from the hospital through education, physical exercise, and nutrition. These community projects have had great results in decreasing readmissions and improving the healthier lifestyles for our community. Finally, projects such as Pink in the Night, or even our community disaster preparedness programs, medication vouchers to the community, and sponsorships all contribute to building a healthy community. This year, Dignity Health had a total of 491 requests for funding. 491, totaling over $14 million. We have 41 hospitals in our Dignity Health corporation, so $14 million spread out over those 41 hospitals. The total of recommendations from these hospitals was 228, with a whopping total of $4.2 million was allocated for this year's Dignity Health Community Grant Awards. At the local level, I need to say this. The largest category for requests was access to medical and dental health, and it far exceeded chronic disease management, who was the distant second. Far exceeded. I think chronic disease management request for that program was about $700,000. So the number one is access to medical and dental. At the local level, right here at Mark Twain Medical Center, we had 22 organizations who requested funding. Of Of these, 6 organizations were asked to submit the final proposals, which you all did. And all 6 submitted proposals totaling over $115,000 just from our community right here, 6 in this room. We are very pleased to provide some funding for each organization, although the total amount falls quite short of what you had requested. But I am confident that the funding that we do provide to you will help your organization to provide help to your communities and your goals for your projects. So actually, I'm going to introduce some people before we actually give out the checks. We have some members of the press here. John Hamilton from the PineTree.net, James from the Calvert Enterprise, and let's see, Sean from the Union Democrat. So be sure to spend some time with them before you leave today so that you can explain more about your projects as you move forward to it. I'd also like to introduce the people that are on our side of the fence at Mark Twain Medical Center. Some of you have had the opportunity to meet Craig Marks, our new president, who's been with us since May. Jacob Lewis, who's our vice president and chief financial officer. Let's see, Nikki Stevens, who's our director of marketing and business development. And see, we have Denise Meyer, administrative assistant. She's my administrative assistant, like today. And let's see, did I miss anybody? I think that's it. Okay, so let's bring up. Yes.
What we forgot to do, Larry, was to thank you. This gentleman has been doing this type of program at this hospital for how many years now?
It's been about 16 years.
16 years. He does a phenomenal job. I'm new here. I've only been here 7 months. So I walk in and I hear about this program, and this gentleman is extremely organized, as you can tell. He's got this all written up for you press folks. You didn't have to take those notes. He'll give you a copy of this. It's well written. You won't even have to change it.
Quote at the back and say Larry says.
I tell you what, he has a whole system set up on every proposal that came in was looked at by a team of folks that I work with every day. And I tell you, it was an extremely fair process. And I think he just did a great job going through and looking at that. And you know, the one disappointment that I have about this program relates to this gentleman right here. Jacob Lewis, who is our Chief Financial Officer. What we really need to do, obviously, is to loosen up those purse strings a little bit. Because when you hear that there's a need for $115,000, you know, and we're able to do $22,000, you know, that's great. But you know what? We sure would like to do better. And we have big plans for Mark Twain Medical Center. Note the new name, Mark Twain Medical Center. We're going to be on the move. We're going to be doing some new things around here. We got a great team. We're excited about that. And the better that we do, the more we're going to be able to contribute back to all you folks. And so that's one of our goals. I'm so pleased that Dignity Health has this type of program. I mean, it makes me proud to be a part of an organization that even though we've got tough times, you've read about our challenges that we have, we still have that ability and that commitment to donate back to our community, because you know what? We can't be a medical center truly without having all of you folks out there providing services that we can't possibly provide. So we're going to do everything we can in the coming years to do even better on our side so that we can share more with you folks. So thank you all very much for coming out here. Thank you, Larry and staff. And we look forward to working with you in the future.
Good, let's get her done.
Yes.
One thing that Craig, when he was, one of the first things out of his mouth when we talked about community benefit and how much we spend on community benefits is, you don't have to spend that much. You absolutely do not have to spend that much in order to keep your not-for-profit status with the IRS. And, okay, we don't, but we do. We really do in this community have to spend as much as we possibly have available to support our community organizations and their mission, which we share.
Yeah, when Larry talked about those millions of dollars, those are real dollars that we really contribute back. So we're giving the community way more back than what we would get from our tax-exempt status. Our charity care total is about what, Jacob, on an annual basis? So this is just free care is about
Oh,
Put them on the spot.
about 900,000 just in free care.
Yeah, so close to $1 million just in free care. And then there's other care that we're compensated, but probably at a loss with Medicare and the Medi-Cal programs. And you folks know all about these things because funding is challenging for everyone, and so for us also. So,
Good. Renee, come on up. Renee Davis. She's with the Hospice of Amador and Calaveras. So, come on up.
Thank you so much. I'm the new development manager for Hospice of Amador and Calaveras, where our mission is to provide quality end-of-life services to all patients, regardless of their ability to pay. I'm here today, thank you so much, again, without the community support of Mark Twain Medical Center, helping us with specifically today our Grief Buster program. Our Grief Buster program is a bereavement program, free, also like our regular hospice services, for children ages 3 to 19. We are, again, in both counties. We serve about 30 students a month. We have specially trained, grief-trained volunteers. I'm so impressed that two of the lovely women I met today, Amber and Kim, are Grief Buster trained. I'm new to hospice, I should have added. So I'm just so impressed by this particular program. One of the things that we also do, we meet one-on-one, the Grief Buster volunteers, that is, at the child's school. And they also have a whole resource of library and videos and books and that type of thing available. Again, this is a service that no one else in the community offers. And thanks to Mark Twain Medical Center, that will enable us to purchase more supplies and continue that amazing program. So thank you so much again for your support.
Okay, Kim Alina, and you steal my paper? Why? You are in trouble.
Larry's actually getting out.